Hi, everyone. Thank you for joining us today. Today, we're joined by Mike Woodruff, our Senior Medical Director, Office of Patient Experience, who's also an emergency physician, to talk about how to seek care related to non COVID 19 issues during COVID 19. Mike, thank you so much for joining us.
Thank you, Amanda. Appreciate it.
Yeah, so there's been a lot of recent reports in the news that people aren't seeking care for non COVID 19 issues. Should I be worrying about going to hospitals and clinics right now?
No, you shouldn't. And let me explain why. While we're doing a lot to keep you well and support your social distancing, through providing a lot of ways to contact your doctor that aren't in person, so getting the highest quality virtual care possible, there may be situations where you do need to come in person, and that's really appropriate. So we've taken a lot of steps to ensure your safety, and these include increasing the space between chairs in our reception areas. We've made hand sanitizer even more available throughout our facilities than it was before. We've established separate reception and treatment areas for patients who have possibly COVID-19 symptoms like cough or sneezing or other respiratory symptoms. And we're making sure that every one of our patients and our caregivers that are entering our facilities are appropriately screened and are wearing a mask. And we've done that to keep you safe when you come to one of our facilities. We've also done something that's been really hard. We've restricted significantly the number of visitors that can come with you to one of your appointments or if you're hospitalized. And that's been a really difficult process because it's a big change. But we're doing it to keep everyone safe. We've got to think about the patients in the hospital, we've got to think about you, and we've got to think about our caregivers who work in the hospital. And so these are some of the really important things we've done to ensure your safety. The bottom line is that you have to have access to take care of your healthcare needs. And for example, if you have a procedure or a lab test related to a medical condition you have, there is no reason for you to cancel that appointment because that might be really essential.
Yeah, you also mentioned the ability to wear a mask in the clinic facility now. I just wanted to point out to people, too, that we're giving out masks to patients at the door if they do not have one. So if you're looking to seek care, but you think that that's something that could stop you, just know that we can supply them to you when you walk in as well.
That's a great point. We've had a lot of donations, thanks to our community, for donating masks that we can give to our patients, but also we've embarked upon a great project, Project Protect, to actually partner with the community, with the University of Utah, with the Church of Jesus Christ of Latter-day Saints, to actually sew a large number of masks and some other personal protective equipment that'll be really helpful in this situation of keeping people safe. Amanda, I wanted to mention one other thing that worries me. It worries me that people might have significant symptoms and be afraid to come into one of our facilities. If you're having a true emergency, like a stroke or severe chest pain or a severe allergic reaction, something that could actually be life-threatening, please don't stay at home. For many of those type of emergencies, even seconds can make a difference. And so call 911 if you can't drive yourself, because our emergency departments are open and they're ready for you. So please don't delay if you have serious symptoms.
My next question was going to be about the ER specifically as well. When people have these urgent matters come up, I think it's good to reiterate that ERs are safe to receive care right now. Can you kind of talk a little bit about what we're doing to make sure that they're safe?
Sure. Well, there's a couple things. First of all, since we've done so much work to provide virtual care venues, the number of people in our emergency departments really isn't that high. We aren't as busy as we usually are. So in addition to that, our emergency departments and our Instacares have both done work to make sure that they can identify people who have respiratory symptoms before they even get into the emergency department. We can register them and we can treat them in separate spaces so that people who don't have COVID-19 related symptoms or disease process remain safe.
So
I think the other
sorry, go ahead.
Thing I wanted to emphasize, that's okay. The other thing I wanted to emphasize was that, you probably don't need to come into our emergency department if you're just seeking testing for COVID-19. We've got a really great process using our Connect Care or our Health Answers line, where you can call in, you can relay your symptoms, and then you can be referred for a test if it seems like it might be appropriate for you. The reason why we do this is to keep all of our patients and all of our caregivers who work in our hospitals and our clinics as safe as possible.
Mm-hmm.
I want you to know that the keeping our patients, our families, our communities safe is really the highest priority for our caregivers, for our people that work in our hospitals and our clinics right now. And that's why they're doing all this tremendous work to change the way that we're providing care. It's really based on safety.
And their families in the community as well. If they work at our hospital, it's not only themselves that they're thinking about, but also their family members that they have to think about. That brings me to my next question. What should I be doing to prepare to go to the ED?
Okay, so if you have to come to one of our emergency departments, first, we're asking that everyone who comes to one of our facilities wears a cloth face covering if possible. Now, if your symptoms are so severe that you can't do that, then that's time to start thinking about calling 911 and getting a team of EMTs there to get you oxygen or get you the treatment you need while you're on your way to the emergency department. That's kind of an important point. Secondly, if you are able to, and you need to come to the emergency department, especially if you have symptoms you think might be related to COVID-19, call ahead. We'd be happy to get a call and be happy to kind of guide you on what it might look like when you drive up and where to park and how to enter the emergency department. When you call ahead, it actually gives our teams the time they need to prepare to care for you in the best way possible.
So if someone gets sick and they're deciding what they should do next, what is the course of action that they should be taking?
Okay, a couple different things. First of all, if the symptoms are mild, and I'm thinking mild flu, mild cold symptoms, the request is that's an appropriate time to stay home to protect others getting sick.
Mm-hmm.
The CDC has a really nice guideline for caring for yourself at home when you're sick, and it's a lot like caring for yourself when you have the flu. You're going to do things like limit going outside. You're going to get an appropriate amount of rest, stay well hydrated, and really try to avoid close contacts with others in your household. Frequent hand hygiene, hand washing your hands, sanitizing, and just being really careful about taking care of yourself and trying to limit the spread of the disease. And lastly, staying in close touch with your doctor. That's a really important thing, because as you monitor your symptoms, you want to know, are they getting worse? Are they getting better? Are you getting new symptoms? And communicating that with your doctor or with our Connect Care line is a really important part of that staying at home.
I also think it's important to note that if you would come in normally to the ER or urgent care for whatever you're feeling, you should probably still do that. COVID-19 doesn't change the atmosphere of whatever condition that you might have. So I think it's important to realize that if you take away the COVID-19 equation, what would you normally do? If you fall and break your hip or hurt yourself really badly, you need to go seek care. It can't be something you put off for 6 weeks. So what are some hard and fast rules to know about when I'm seeking care in person versus staying home as well?
So I think there are some general guidelines, and there's some cases where it's really easy to know if you should stay home or come to the emergency department or one of our Instacares. Now, you can all think about the severe things like a severe injury or a heart attack or stroke symptoms. That's easy. You need to come in. You need to call 911 and you need to come in. The other end of the spectrum is if you have a sniffle, you probably don't need to come in and be seen. We have plenty of great ways to work with you virtually. And we've got a great website that can answer your questions. Has a lot of frequently asked questions. and it's got a huge amount of really useful information. It's even got a symptom checker. So that's a great place to go and get educated in those kind of more minor symptom situations. But the gray area is in the middle. And that's where it's really important to make those decisions in conjunction with a health professional. And again, so if you sprain your knee and you think you might need to be seen, we're there for you. We can see you. But it also can be helpful if you're not sure if you need to come in. You can call ahead. You can call our Health Answers line. You can call our Connect Care and talk to someone on the phone who can walk through your symptoms with you and help you decide if it's going to be valuable for you to come in person, because there's no way to make a rule that covers every single situation. We want you to get the treatment now that you need to stay healthy in the future.
And those phone numbers too, I'll give at the very end, but there's a couple different resources that Mike's been talking about that are really great to access when you're not wanting to go to the hospital yet or wanting that second opinion too. So say for instance, I do get an injury. What's my best course of action for seeking care?
Okay, well, I just want us first to remember that we have so many well-trained clinicians and teams that are on duty right now and all through the night, 24/7, 365, that are there to help you if you get injured.
Mm-hmm.
If your injury is something that can't be treated with just a Band-Aid, some ice, and a Tylenol, then it'd be totally appropriate and normal for you to be treated through our Instacare or emergency departments. And again, if it's a severe injury, then that's when you got to call 911. But I just want to assure you that we're there for you. We have people standing at the ready, and we've taken all the steps that are possible to make sure that if you do, I hope you don't, but if you do, then you'll be safe when you come in.
I think the part about outside, the weather is great. People are hiking, backcountry skiing, and I think it's important to think about what you're doing right now and the level of danger it could potentially have. I wouldn't recommend going backcountry skiing by yourself, because if something happens, then you might have to seek care by yourself and it could be a little bit more stressful. So just thinking about what you're doing to reduce the risk of injury as well, I think is important.
Yeah, the way I think about it, Amanda, is that now is the time when we need to try and stay as healthy as possible. And that's for us, it's for our families, and it's for our community.
Mm-hmm.
And so doing everything we can to make sure we're trying to avoid injuries and that we're trying to avoid illnesses, we're getting the right amount of rest, we're eating well, we're exercising, not in a dangerous way, but exercising, and just doing all things to strengthen the immune system and strengthen our ability to fight an illness when it comes. That's going to be really important now.
Well, we really appreciate your help protecting our community from the transmission of COVID-19. It's our foremost duty as healthcare professionals to help keep people safe from harm, and it's a duty we share with you guys as well. We all hold an important public health responsibility during these unprecedented times, and your support in the response to COVID-19 is invaluable to preserving the health and safety of our community. The couple of phone numbers that you guys can use as well, we have the COVID-19 hotline that Mike referenced. That phone number is 844-442-5224. There's also Connect Care, which you can access at our website, which is intermountainhealthcare.org. And we also have our emotional health relief hotline at 833-442-2211. Thanks, everyone. We'll talk to you next time.